So now, the symptoms appear 24 to 72 hours after the onset of drug therapy. Okay, you need to be very strong in this kind of timeline because the other features, the other drug-induced hyperthermia is serotonin syndrome. Serotonin syndrome is usually abrupt, acute. The patient takes the medicines and comes to you in almost within 6 hours. Around 80 to 90% of the people come within 6 hours. So this itself can be taken as a differentiating feature between the serotonin syndrome and the neuroleptic malignant syndrome. Okay, in serotonin syndrome, it's abrupt onset and the recovery is also going to be a little faster. Okay, in neuroleptic malignant syndrome, the symptoms appear itself is after 24 to 72 hours only, and all the cases are going to be apparent in the first 2 weeks of drug therapy itself. Okay, and the onset is gradual and can take days to develop. Okay, 80% of the cases manifest with muscle rigidity or altered mental status. And this muscle rigidity is usually a lead pipe rigidity and less likely to be a cogwheel type of rigidity, because a cogwheel means there is tremors. You try to flex the patient's hand, the patient have tremors, so it will be a cogwheel. So here in neuroleptic malignant syndrome is more likely a lead pipe rigidity. Lead pipe is a continuous form of rigidity. It's called lead pipe rigidity. The change in mental status can be from little agitation to complete coma. Okay, so in the RAS scale, it can be +4 or to -4 as well. Hyperthermia can be there because of hypothalamic insult of low dopamine. The body temperature can go as high as 41 degrees Celsius, and this is required. There should be a hyperthermia to diagnose your NMS. And the point to be understood is that it's not that all the drug-induced hyperthermia syndromes need not present with hyperthermia as a first sign. Okay, the hyperthermia can be delayed for 8 to 10 hours. So if the patient is not having hyperthermia, do not exclude the drug-induced syndromes, drug-induced hypothermic syndromes. The hyperthermia can be delayed for 8 to 10 hours as well. Okay, with other documentation, with other clinical features, you need to identify these syndromes and you need to observe the patient whether the patient is developing hyperthermia and treat accordingly. Okay, autonomic instability can produce cardiac arrhythmias, lactic acidosis, labile blood pressure. Because of all these things put together, can cause persistent hypotension, shock, or eventually multi-organ dysfunction as well. So now you have a patient